Well, if it hasn't happened to you, this is certainly a diagnosis that's been given to someone you know, and I'm talking about cancer. But once treatment of the disease is over, many cancer survivors are left dealing with long-term sexual problems. And if you are too shy to talk about this issue with your friends or even your doctor, don't worry, because today we're going to do it for you. We welcome back our sexpert from Wayzata Cosmetic Surgery and Spa, Dr. Lisa Oman-Erhard. Nice to see you, Dr. Lisa.
Thank you for having me back.
Big topic that a lot of women are talking about. And, you know, when it comes to cancer treatment and then sort of that feeling of relief, I'm sure for a lot of women, which is, okay, I beat the cancer, we're moving on. I wonder if there's a feeling of guilt for a lot of women after we're thinking like, I should just be grateful for my life. I shouldn't necessarily be upset about my sex life. Do you ever find that when you're talking to women?
Absolutely. First of all, it's a subject that no one is talking about.
Yeah.
So these patients are completely unaware that there's a possibility that this could be something that impacts their life or their relationship. And so both the teams of doctors as well as afterwards, there's just little or no discussion about the potential side effects of treatment.
So let's talk about this. It's the side effects of the treatment of certain types of cancer. So it's not really that you're dealing with this issue because of the cancer itself. It's the treatment. So which particular cancers are women being most affected in terms of their sexual health after treatment?
Sure. So the most common cancers would include breast cancer, ovarian, cervical, uterine cancer, as well as colon cancer or any type of cancer that involves the pelvis.
Okay.
And so any of those, but potentially any cancer, because chemotherapy itself can actually cause premature ovarian failure or lead to premature menopause.
So radiation and chemotherapy, those are, you know, this kind of the standard of cancer treatment. So is it those that are mainly responsible, or is it this tamoxifen?
Tamoxifen is a very common treatment for breast cancer that basically further suppresses any hormonal production. It is commonly used for breast cancer patients. But not only do breast cancer patients have the mastectomy and the loss of femininity as a result of that, but they'll find that the tamoxifen further robs them of any hormonal stimulation, and so it'll lead to severe pain, dryness, discomfort. Really, it will interfere with their ability to have intercourse, which comes as a shock to both the patient as well as their partner.
So we're not talking just about saying, okay, I've had cancer, I've been through all of these things, and maybe I don't feel the same desire that I once felt. It's a real, in terms of the logistics of what's going on, making it even work to begin with, right?
Absolutely. There's severe pain, and it often precludes the ability to even have intimate relations. So again, this is something that patients are completely unaware of. And there is both no help for the couple, there's little or no discussion prior to or afterwards, and so they're often very devastated, but commonly even the patients themselves aren't necessarily talking with their husbands.
Yeah.
And so husbands may take it very personally that they're being rejected, and you know, it's very difficult not to be able to be intimate with the person that you love.
Absolutely. So what is a solution that you are seeing have an impact on women's lives and then the lives of their partners and then their entire family, I'm sure?
Yeah, absolutely. You know, no question that I'm sure the loss of intimacy contributes to a fairly high divorce rate after cancer, you know, which is, you know, another devastation.
So you survived this huge thing, and then there you are left trying to figure out your relationship.
Absolutely. So, so we're very excited to offer a brand new treatment that really offers tremendous hope and really a resolution of the pain, the dryness, the discomfort the patients are feeling. In addition, not only do they have those, but there's a loss of arousability, some atrophy that occurs all the way around. This is a laser treatment called Mona Lisa Touch. So Mona Lisa Touch is basically just the trade name for a special laser treatment that basically jump starts all of the tissue back to being healthy again. It's non-surgical, non-hormonal, it's non-painful. It's about a 5-minute procedure.
Wow.
And we're seeing absolutely phenomenal results.
So how long? I mean, you get the procedure, 5 minutes. Are you feeling good the next day? Or I mean, what's our recovery time? And then how long until you can really see an impact in terms of your sexual relationship?
It's actually quite amazing. So most of our patients are, again, it's non-painful during the procedure. They don't have any downtime. There might be a little discomfort, irritation for a day or so maximum, but typically within 2 weeks, our patients are reporting definitely improvement in moisture,
Wow.
a significant change. We had a 70-year-old patient. She had had breast cancer 25 years before. She had not been sexually active for over 20 years, and her husband passed, her original husband passed. She had a new boyfriend and came in to find out if there was anything that could be done.
I love this.
Absolutely. So I wasn't sure whether or not we were going to be able to help her, given that both her age as well as number of years that she had been inactive.
For the problem, yeah.
It was amazing, absolutely amazing. So when she came back to see me after her first treatment, her comment to me was, Dr. Ehrhard, it's like a rainforest down there.
Dr. Lisa.
And she was thrilled.
I told you, if you were embarrassed to talk about this with your friends, I was going to take the hint for you.
There you go. So, but she is so thrilled to have this back. She can't,
Listen, this makes turning 70 seem a lot better than it did just a few minutes ago.
Absolutely.
Wow.
And the fantastic part about this, of course, is that breast cancer or cancer survivors, they're the worst case scenario. They often can't have hormone therapy.
Yeah.
You know, they can't even, have other types of therapies that the general population can. But this is a therapy that is available to everyone. So, it definitely offers hope to even patients who don't have cancer, but have the same type of painful relations.
Well, thank you so much, Dr. Lisa.
Absolutely.
We love having you here. And to learn more about the Mona Lisa Touch, you can call Wayzata Cosmetic Surgery and Spa for a free consultation. If you mention Twin Cities Live during the month of November, new patients can save 20% on the procedure. And all the details are on our website, twincitieslive.com. We want to thank Wayzata Cosmetic Surgery and Spa for sponsoring the show. Nice to see you. Thanks.